Pregnant women, how are you? Everybody, how are you? Welcome back to my YouTube channel. I am Stacia Mbruka, and today we are talking about a very important topic: hypertension in pregnancy, also known as high blood pressure during pregnancy. This is one of the leading cause of complication for mothers and babies, so understanding it can truly save life. I know you are going to confuse about preeclampsia, eclampsia, hypertension in pregnancy, but I'm going to talk about hypertension in pregnancy. So let us look at what is hypertension in pregnancy. Hypertension in pregnancy simply means that a pregnant woman's blood pressure is higher than normal. That is, it is above 140 over 90. It can appear before pregnancy, during pregnancy, or after delivery, depending on the type of hypertension you're having. Now, let us look at some of the type of hypertension in pregnancy. There are four main types you need to know before you understand everything. So we have chronic hypertension, we have gestational hypertension, we have eclampsia, and we have preeclampsia. Those are four main types of hypertension that you need to know. So let us look at what is chronic hypertension. That is number one, the first one. Now, this is when high blood pressure was already present before pregnancy, or it was diagnosed before 20 weeks of pregnancy. We will call that one chronic hypertension. It means you had hypertension before pregnancy most of the time. Most of the time you had a hypertension before pregnancy, or it was diagnosed before 20 weeks of gestation or pregnancy. Now, what is gestation hypertension? That is the second type. This is high blood pressure that developed after 20 weeks of pregnancy without protein in urine. Yeah, without protein in urine, not that, without protein in urine. Your blood pressure is high is higher more than the normal range, and it is diagnosed 20 weeks after pregnancy or 20 weeks within pregnancy period, and there is no protein in urine. Now, type 3, which is preeclampsia hypertension, the most dangerous type. It is when hypertension is accompanied by protein in urine and can affect organs like liver, kidney, and brain, vital organ in your body. And now, the type 4, which is preeclampsia. What is preeclampsia? Preeclampsia is complicated eclampsia, not preeclampsia. I've talked about preeclampsia, so the next thing that I'm talking about is eclampsia, and eclampsia is a complication of preeclampsia, and it is accompanied by seizures. And remember, it is a medical emergency and can put a life of the mother and the baby in danger. In medicine, we have to know the cause, and if we don't know the cause, then we have to know the risk factors. What can make someone be at risk of getting a condition, or what can put you susceptible for a specific condition. For this case, we are looking at causes or risk factors of hypertension in pregnancy. That is, remember, in pregnancy, the exact cause is not always clear, but some women are at high risk of getting hypertension in pregnancy. And what are these women, or who are these women? Number one, first-time mothers. If you are a first-time mom, then you are at risk of getting hypertension in pregnancy. Number two, multiple pregnancy. If you are carrying more than one baby, you are at risk. Obesity is one of the risk factors of so many conditions. Number four, family history of preeclampsia. If someone in your family has ever suffered from preeclampsia, then you are at risk. Number five, pre-existing hypertension. Pre-existing hypertension will put you at risk of getting hypertension in pregnancy. And also, if you have kidney diseases or diabetes, you are at risk of getting hypertension in pregnancy. Another point is pregnant mothers who are 20 years and below, or who are 35 years and above. So those are some of the things that will put a mother at risk of getting hypertension. Now, let us look at signs and symptoms someone should watch out so that they are aware of what is happening, or they can do what can seek medical attention. Persistent headache. If you are pregnant and you have persistent headache when even if you take drugs, if you take analgesic like paracetamol, it doesn't go away, or it goes after sometimes it comes. Please kindly go and see the healthcare team. Number 2 is blur vision, or you just can't see well. You all of a sudden you cannot see well. It is a warning sign. Can you go to the hospital? And number 3 is swelling on the face, swelling on the feet, swelling on the hand, swelling the whole body. You need to go and see the doctor. Sudden weight gain. You were 45 and all of a sudden you are now 85. Can you go and see the doctor? Something is wrong. Upper abdominal pain, nausea, vomiting, decreased urine output. If you notice those, kindly seek medical attention immediately. How can this hypertension in pregnancy be diagnosed? Doctors monitor blood pressure every antenatal visit. Let me say again, doctors and nurses should monitor blood pressure every antenatal visit. They may also do urine tests to check if there is protein, if you have preeclampsia, eclampsia. Also, they can do blood tests to assess the kidney and liver function, and ultrasound also can be done to check the growth and well-being of the baby. Those are how doctors and nurses diagnose and monitor hypertension in pregnancy. Now, let us look at how can this be managed and treated. Treatment depend on the severity. We have mild cases, we have severe cases. Yeah, so it depends with the severity of the condition. If in mild cases, you can manage with rest, frequent monitoring, dietary changing, reducing salt intake. But in severe cases, you may need medical attention, and you may need nifedipine. Let me say you may need antihypertensive drug to manage the condition, which as hypertensive drug should be safe for pregnancy. If you have preeclampsia and eclampsia, the mother might need magnesium sulfate to prevent seizures, and sometimes early delivery will be needed if the condition worsen. So those are just some of how it can be managed, although we have so many management that if you are, these are just some of the things that I'm mentioning, so that at least you get a clue of what is happening or what you can expect. What are the possible complications that might set in if you have hypertension in pregnancy? If hypertension is not treated in pregnancy, it can cause placenta abruption, that is the detachment, early detachment of placenta. It can you can get preterm delivery. With preterm delivery, you are putting the life of the baby at risk of so many complications that we will look at them in a different video. You can have a low birth weight baby, organ failure, because with preeclampsia, it will put you at risk of kidney, brain damage, such things, and even death for both mother and the baby. Those are some of the complications. I'm saying some, there are many, some of the complications that might set in if you have hypertension in pregnancy. Now, let us look how it can be prevented. You already know that prevention is better than cure. So to lower your risk of this complication and any other damage, attend all antenatal clinic regularly, or as you have been instructed to attend. If you attend clinic as you have been told or as you have been instructed, the doctor or the nurse will be in a position to identify this condition in their early stages, so that you don't get complication, and they will be managed, and then you will just get your baby normally. Eat balanced diet with fruits and vegetables. Avoid junk foods. Avoid being obese. If you want to get pregnant, avoid being obese. Avoid too much salt and fatty foods. Exercise moderately as advised by your doctor, and most important, never miss your blood pressure check. If you go to a clinic and they don't check your blood pressure and you're pregnant, kindly leave that clinic with immediate effect and go to the next clinic or go to the next hospital. A pregnant mother, we don't joke with vitals, with taking vital signs. You should not joke with, you should, some, I, okay, let me calm down. Some private hospitals, they usually don't take blood pressure. They usually don't take vital signs for pregnant mothers. For if someone is not pregnant, then sometimes you can assume, but you should not assume. You should not assume. Vital signs are very important because it will give you baseline data, baseline information of what you are dealing with. Sometimes you just assume that you are dealing with uh, just as a normal headache, but sometimes someone is having hypertension. So if you don't take if you don't check blood pressure, how will you know that this person is having hypertension? Yeah, how will you know? How will you start managing this patient without having the baseline data? So it is important that if you're pregnant and if you go to a clinic and they don't check your blood pressure, then you should leave that clinic or you should leave that hospital alone. Go to where you can get help, where you will be managed properly, where you will be their what? Their concern. Yeah. So hypertension in pregnancy is serious, but with early detection and proper care, most women go on to have a safe delivery and healthy babies. You know, these complications, we usually get them if this condition was not managed, the condition was not detected in early stages. So that is why sometimes we get this complication. You can carry your baby to term with preeclampsia and deliver a healthy bouncing baby, but if you don't go for clinic, if they don't you don't prevent yourself from getting these complications, then you will get a lot of problem at long last. So if you found this video helpful, like, share and subscribe for more nursing health education and content. Remember, a healthy mother means a healthy baby. Yeah, a healthy mother means a healthy baby.